Hello. Here we are. This is 20 days after open heart surgery, and it's time for the second scar mobilization. Theoretically, I could do more of those scar mobilizations until now, but I do so much around my health and it takes so much time that I am barely able to even squeeze more. And in the free time, I rest, and there is also a regular life around. Today, I will use a bit more intense techniques. Obviously, the goal is like in the previous session, so I want to make my scar feel comfortable and I want to achieve very good gliding of the tissues. I want them to move comfortably in all of the directions. Right now, as you see, it's pretty stuck, which is normal. And when I grab the scar like this, it pulls inside. That's why it's time to do something about that. If I will not take care of that now, it will sooner or later cause some problems with my neck, with my back, with muscle activation and overall comfort. Now is the best time to do it. The biggest problem right now, as I feel it, are the drainage scars. They didn't heal fully yet, so I cannot work on them directly. So I will work a little bit around. And they are very stiff, and I feel that they are pulling quite strongly throughout the day. I feel like I'm trying to protect them, so that's obvious sign that I will need to spend a lot of time there. And when I palpate my scar, the bottom of the main scar feels weird, feels numb, feels uncomfortable to touch that. So this is something that we're gonna work on as well. Obviously, I'm a physiotherapist. I know what to do, and my intentions are best. But this treatment is not for everyone. Something that works for me may harm someone else. So every treatment that I do here should be treated more as a suggestion of treatment, some sort of the recommendation, general recommendation, but every case is different. So if you have any doubts that something may not be good for you, it's better for you to see a physiotherapist somewhere near you that will do the mobilization for you. Today is a perfect day for scar mobilization because my results are crap. My whoop, whoop, as they say in the commercials, tells me that my nervous system is pretty fried, and it's because I did a lot yesterday. I did breathing exercises, strength training, and a very long walk in the forest, and that was amazing. I was very happy, but today it's clear that I overdid it. Also, I decreased the dose of beta blockers. My doctor advised me to do that. So all of those factors made me more tired today. What to do? So today, infrared lamp, massage chair, and scar mobilization. The rest of the day is just chilling, playing Witcher, reading books. That's it. And that's fine. I'm going to start with so-called comfort techniques. Some areas they feel very uncomfortable, so starting with something rough may be too much, may fry me too quickly. So we're gonna start with something that obviously works, that calms down the nervous system nicely, that releases the tension nicely, but it's very gentle. I touch gently two sides of the scar and I compress the scar. And I don't push all the way in, just gently. Regarding how long I should hold this position, it depends. If I feel that there are relaxations happening under my fingers, then I can hold it even until 10 minutes, until I notice those relaxations are happening. If there is no relaxation happening throughout 1 minute or more, then it's a good enough sign to change the technique or move forward. If I feel very comforting, nice, fuzzy, warm feelings, I wait until they are there. If it feels nice, that is very often a sign that we should continue with a certain technique. Sometimes it can also be the opposite. If I do something like this and I feel the pain, like someone is stabbing me, that something is scratching, something is burning, then obviously that's a hypersensitivity. And if it's decreasing throughout the time, then I hold the position as long as it's necessary. There is no shame in holding certain position for 10 minutes if it's working, if it's providing some change. If it's not changing, then just move forward. some change already happened. As I said, there were moments, so there were places where I felt amazing, very nice, comfortable feelings, and sometimes I felt pretty awful, not nice, painful, and sometimes there are emotions also hidden in the scar, everything associated with the surgery, something that we are not 100%, that I was not 100% aware of. But when I was working on the scar, it became apparent. Our body lives its own life, separate from the mind most of the time. And it may turn out that when we work on this car, certain emotions may come out, which is fine, which is the part of the process. There is no wrong answer. Whatever happens, it's fine. There are two other options that may happen. The first one is that nothing is happening, no relaxation, no change, then we just proceed. And sometimes the sensation may be so overwhelming that we become agitated, closed, tensed up. If we notice that something like this happens, we have to pause. Our nervous system may not be in the condition to digest something, so we have to use some gentle techniques or try another day, or this tension is necessary for something right now, so it's better to work in different areas. Second conforming technique is just sliding on top of the scar. In my experience, in the areas where the scar feels burning, irritated, it's better to use this direction. In the areas where it feels numb, dull, heavy, this direction works better. Now, in my case, there are areas that feels heavy and there are areas that feels burning. So I will just use two directions. Obviously, I will try to avoid this little spot that didn't heal yet and those two guys over here. Okay, let's start. Let's proceed with a bit more intense technique to mobilize the tissues a bit more deeply, and the rules are basically the same. Okay, awesome. Regarding the force that I used, it was very little. The scar is still fresh and it was relaxing, even though I was using small amount of strength, so it's all fine. Some people may be concerned that it's a bit too easy to mobilize the scar because of the bone injury that is beneath. The reality, however, is that if I cough and everything is fine, then something like this is so much less force acting on that it should be fine, really. I'm going to use the same technique on the drainage scars right now. We're going to work a little bit around the scars. In this technique, if if your hand is getting tired quickly, you can use the paper towel. It will enhance your grip strength. I'm not a fan of using oil in those techniques because so with oil you just slide on top of the tissues, you don't really grab them, you don't mobilize anything that is deeper. It's not bad to apply some sort of a cream or oil. I will actually do it at the end of the session, but I prefer to work it on dry. Now I will grab the scar in this way. I will try to grab the tissues beneath the drainage scar and I will assess in which directions it moves the best, in which directions it moves the worst. Firstly, I pull towards the best direction to check if it will work, and I wait until it relaxes. If it relaxes, great. If it stops relaxing, then I start to push to the restricted directions. And the rule is like with stretching. I push to the level of discomfort. 5, 6 out of 10. When it decreases, I push a little bit more, and then a little bit more, and then a little bit more. If I push too much, I risk damaging the area, so there is no point in doing that. If I press too little, the effects may not be as visible. So 5 out of 10 is like a sweet spot. Okay, amazing relaxations happened. There is one more place where I want to use the same technique, and this is the place where I had a cannula on the right side of my neck. I already noticed today that I have some grainy structures here that are not present on the left side. One is pretty rigid, so I will use the same technique. I will heat it up a bit and first with some friction, and then I will mobilize that to the sides. So let's do it. It feels better here, but in the same time, it feels like some fibrosis happened here. I will observe that for sure in the matter of the next few weeks and months. It doesn't look bad from outside. It's pretty mobile, so it shouldn't cause any kind of problems now. For this technique, I have a specialized equipment in my clinic, but here I have to be happy with just toothpicks. So basically, there are areas that are not feeling right, and this technique is great for those. Basically, what I want to do is to pinch the area pretty quickly, exploring the area around the scar, on the scar only a little bit, simply because the skin is still very sensitive. And this technique, done properly, should feel very neutral, like something's pinching you. But in some areas, it may recreate some pleasant or unpleasant sensations. In this spot, for an example, when I pinch this area, I feel pressure increasing in my head. I feel some degree of oppression. So that's a good enough sign to work here for a little bit longer and to observe if it will change. What I wait for is the sign of the relaxation of the nervous system. So just a big breath out that sometimes happens naturally. If something like this happens, then that's a good sign. Or the realization of the nervous system that it isn't that bad. So I wait until the area rebounds. And the last thing, I'll use this little guy to work on the scar and the surroundings. The temperature, let's put it to 45 degrees, and it is a great tool. It works slightly different on the tissues. It mobilizes them in a slightly different way, which is also necessary. And I will use this cream, very good for scars, highly recommend. So yeah, let's do it. Zero force, zero pressure. I really don't want to damage this car, so I do it just very superficially. It feels weird. Okay, we are done for today. This car feels definitely better, more comfortable. I also feel very relaxed. I feel like a lot of bad energy left in the body. So these are very good signs. My discovery is that I have a pretty big area of numbness. I will work on that. If this area is numb, it means that the innervation of this area comes from the spine directly throughout the ribs. So perhaps I will look for some soft tissue restrictions at some time, or and I will focus also on the local work, trying to stimulate the area, increase the blood flow. This scar is much more reddish now, which is a normal thing. It will last for a few hours because of the increased blood flow to the area, so nothing to worry about that. So we enhanced the healing process. Amazing. I'm very happy with that treatment. And now this car has few days of rest, probably in a week, 5, 6 days. I will be able to perform the next treatment. It will be probably the same, so I will not record that. There are for sure techniques that are also necessary to achieve the best results, but they are not for now. My body needs much more time, so I could use them. So for now, that's everything. Thank you. Hopefully, it helps someone.